Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, ladies and gentlemen, esteemed viewers and fellow healthcare enthusiasts. Welcome to yet another riveting edition of the DOCtalk Show, proudly sponsored by the Ministry of Health of Uganda and its partners. I am Dr. Muyanga Andrew, your host tonight in the journey into the world of medicine and healthcare, where we dissect a number of issues pertaining to your health, unravel mysteries, and most of all, give you information that will enable you to take charge of your health. Tonight in the house, we are graced with the presence of two specialists from Mulago National Referral Hospital. That is Dr. Masaba on my left, and on the far left, Dr. Odongo.
My name is Dr. Masaba Joseph. I am a urologist working with Mulago National Referral and Teaching Hospital on the urology unit.
Thank you, Dr. Muyanga. Good evening, viewers. I'm Dr. James Odongo. I'm a urology fellow in the urology unit of Mulago Hospital.
Thank you so much. Certainly, as we go along the way, we shall need to be reminded of who a urologist is. Last time, as I was saying, we had a discussion about benign prostatic hyperplasia, which was ably dissected. And certainly the viewers were interested in other issues related to the prostate. Most commonly, they talked about the need for us to discuss more about prostate cancer. So tonight in the house, our discussion is mainly going to focus on prostate cancer. But as we start, we would like to know, for the viewers who are not with us, what is the prostate?
Yes, the prostate it's an organ in the males. It's in the pelvis, located just at the bladder outlet where urine comes out from. The bladder is an organ that stores urine. Of course, urine is made by the kidneys. From the kidneys, urine comes to the bladder through the ureter. There is another tube there called the ureter. So the bladder stores urine until when it is full, then you start feeling, the feeling to pass urine will come. Now the prostate is just located at the outlet of the bladder where urine comes out to the urethra. And the urethra is another tube where urine comes out through. It traverses through that prostate. So the prostate is traversed by the urethra at the bladder outlet, and it produces fluids that adds to the bulk of semen. Semen, that is the male fluid in men that carries sperms. Sperms are within semen. So the prostate produces fluid that helps with transporting sperms in that semen. That's what the prostate does.
Interesting, interesting. Now, coming back to the first issue, I requested our guests to tell us about who is a urologist.
Well, Dr. Muyanga, a urologist is a surgeon who has specialized in managing disease which is related to the urinary and reproductive system, and both men and women. So when you have issues passing urine, you need to report to see a specialist like that. How does one get there? You must have, of course, qualified through your medicine, all right? You must have specialized in general surgery, and following your specialization in general surgery, you then super specialize in managing surgical urological disease. That is disease which needs an operation.
Dr. Masaba, in just a few words, what is prostate cancer?
A cancer is an abnormal cell. every cell in the system has the potential of becoming a cancer cell. So for the viewers out there, to understand what a cancer cell is that every cell in the human body is born and is programmed to die at a certain time, and it is replaced by a new cell. There are exceptions to this rule, and that is where we come in with a cancer cell. So a cancer cell is a cell which is defying what we know. It is a cell which is multiplying at a very high rate, and it has the ability to affect every other normal surrounding cell. Not only does it affect every other normal surrounding cell, but it also has the ability to move from one organ to another. That is where we say, oh, a person has advanced cancer. So in the normal cell, a cell does not move from one organ to another. So within the system, if you have a cell which is designed to do a function in the liver, it will never leave the liver and go and stay in an intestine or go and stay in the brain. No. Now with cancer cells, they defy the norm. You get a cell which has undergone a change, and that change has caused it to rapidly divide, and it is an abnormal cell. So it is rapidly dividing and destroying every normal cell with surrounding it. So it will move from one location and go to another location. That's what we mean by a cancer cell. So in regards to prostate cancer, we are talking about a cell which is originating within the prostate itself and has become cancerous. And this has the ability to move from the prostate gland and go to any other surrounding organ. It can go to the bladder, it can go to the rectum, it can go to your bones. So it can affect any structure which is surrounding the prostate. That's what we refer to as prostate cancer.
Certainly we have appreciated what the prostate is. We have, through the help of Dr. Masaba, still appreciated what prostate cancer is. What we would like to know or understand is, one, who is at risk of prostate cancer? And the other issue maybe which we need to understand is, what is the burden of this disease within our population?
Yes, so prostate cancer is the commonest cancer among men of African descent. When I say African descent, I hope the public understands. It doesn't matter where your geographical location is. You may be in Uganda, you may be in Australia, you may be in Russia, you may be in America, irrespective of your geographical location. As long as you are a male of African descent, the likelihood of getting prostate cancer is higher among other races. But also, it affects men in the 8th decade of life. That is, men who are 80 years old and older. However, we do also see the same condition happening in men in their earlier years of life, the 4th decade, the 5th decade, 6th decade, 7th decade of life. So there are some factors which can cause men to get prostate cancer at an earlier age. And these include factors like genetic factors, meaning the trait is running in a family. There are some genes which are in the family which predispose men to get prostate cancer. If you have had a first-degree relative, and when I say first degree, I mean your biological father has had prostate cancer at a certain stage in life, the likelihood of the male children getting prostate cancer later in life, the risk is, or the likelihood or the risk increases threefold. Then we have people who have a risk of getting breast cancer. Research is now showing that In families where there's a high risk of getting breast cancer, the likelihood of the men who are born by the female who has that risk developing prostate cancer in life, late in life, is also high.
So if my mother had breast cancer,
Yes.
chances of me, the man,
Yes.
getting prostate cancer,
The likelihood, there's a risk that you will develop
increase.
prostate cancer at a certain stage in life. There are other factors, as Dr. Odongo is going to give to us. And of course, much as we're saying this, we do not know what causes this cancer. We just have risk factors. So genes is one of them. We don't know whether it is the environment or it is something we're eating, but there's a lot of research which is ongoing to try and find out what prostate cancer, what causes prostate cancer. But yes, the other factors Dr. Odongo can tell us.
Yes, the other factors, thank you. Old age, as he has already mentioned, we see it in men in what? The older age group. And then the black race, family history. You know, no, prostate cancer moves through the family. So that's why even these days when we are doing screening and there is family history of prostate cancer, you start it earlier because they are likely to develop the cancer earlier in their lives. So you start earlier, like at 45. So prostate cancer is something that moves through the family. Then lifestyle. It's like the other topic, BPH. Even in prostate cancer, lifestyle has a risk. Sedentary lifestyle, you're not doing exercise, you're drinking alcohol, you're smoking, that is sedentary lifestyle, and you're always indoors. So someone who does exercises is better off. Someone who does exercises, eats a healthy diet, full of fruits and vegetables, drinks water, does exercises, is much better. It reduces the risk of getting prostate cancer or developing prostate cancer.
Well, that's certainly a lot to take in. Let us have a quick commercial break and we shall be right back.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
This is it, the moment we've all been waiting for. The high school crossfire grand finale is here.
They should come here and clarify. Are they going for organic or inorganic farming?
This is what we call the high school crossfire.
Appointments Committee of Parliament is greatly influenced by His Excellency.
The passion, the intensity, these students are ready to make history.
Human trafficking is a transnational crime that needs collective action.
We, the team affirmatives, brought corruption as being the result of lack of term limits.
Stop engaging in a lot of analogical discussion that then has no causal link to your case.
We all know that human trafficking is a subsisting crime.
You both put up a good fight against each other.
Every debate round has been a showcase of incredible talent, and it's now the time to see the best of the best.
This grand finale will be an unforgettable experience. We can't wait to have you there.
The best teams walk out with amazing prizes. 5 laptops, a school water tank, 65-inch smart TVs, unforgettable trips to Uganda's top tourist destinations, and an incredible opportunity to represent Uganda at the ESDC in Istanbul, Turkey. Join us at Lugogo Hockey Grounds on September 30th for the High School Crossfire Grand Finale. Be part of the excitement, the passion, and the triumph. See you there. Audio Jungle.
You used to tell me that I don't make you happy. All that time you would be complaining. I'll call you every day, yeah yo, baby don't know.
You can now get all the Chibuzi out with MTN voice bundles. Call all networks. Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000. Or buy any daily voice bundle of your choice. Dial *100 *21 hash and select daily, or use the My MTN app. When we talk together, we are unstoppable.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Well, welcome back from the commercial break. This is the DOCtalk show. Our esteemed viewers, please keep the comments coming in via that number that is being displayed on the screen. So the discussion tonight is about prostate cancer, and we have quickly talked about what the prostate is. We have talked about who is at risk of getting prostate cancer. And Dr. Masaba, we would like to know what symptoms or what can I see to know that I may actually be having prostate cancer?
Yes, thank you, Dr. Muyanga. So prostate cancer is the way it can be recognized. It is one disease which likes to present in a way similar to other disease conditions which affect the passage of urine. So in our last talk show, we talked about benign disease giving you difficulties passing urine. So prostate cancer, just like benign disease, will also give you difficulties passing urine. However, what is unique with prostate cancer is that because it's a cancer which can, it's a disease which can spread to affect other systems, it commonly affects bone when it is spreading. So on top of having difficulties passing urine, our patients tend to present with bone pain. The commonest site is back pain. I'm not saying that all people with back pain have prostate cancer. No. All I'm saying is that if you're above the age of 50 and you're having this recurrent nagging bone pain in the back, which never goes away, and on top of that, you're having issues passing urine, then there's a possibility that you could be dealing with prostate cancer. On top of that, the people who have that kind of bone pain tend to have weakness in their legs. A person who used to walk with ease, you begin walking with difficulty. You walk as if you're stepping on sharp stones. When you're having those, you're looking at a possibility of having prostate cancer. Some other symptoms Dr. Odongo can also tell us.
Yes, so prostate cancer, like the advanced stage, Dr. Masaba has already talked about weakness of the limbs. Sometimes you can have incontinence of stool, especially if cancer has the ability to spread. That's why it's called a cancer. It can spread from the primary location to another site. So prostate cancer can spread to the rectum and even to the sphincters. So you lose control. So stool just keeps flowing out. That is called fecal incontinence, urine incontinence, if it has invaded the sphincters. And then you can even have blood in urine, blood in semen. You can have that. You can have similar symptoms like we discussed the other time. You're going to the toilet so many times to pass urine, because a normal person should pass urine at least after 2 hours from the previous time they passed urine. But for you, 2 hours have not passed, again you want. At night you wake up very many times to pass urine. Urine is waking you up at night. You can't postpone the desire to pass urine. A normal person should be able to postpone. When I get a desire to pass urine, I should wait until when there is a toilet. But these people can't. So they pass urine as long as the desire rises. They can't wait. Then they strain. They are aware that they are passing urine. Because ideally, you're not supposed to be aware that you're passing urine. Even when the heart is beating, you're not supposed to be aware that the heart is. Now, if you start becoming aware that you're passing urine, you are putting effort, urine should start flowing on its own. So you're putting effort, the stream is weak, you can't project the urine stream. That means there is a problem. Now, you also feel after passing urine, you feel some urine is remaining in the bladder. That should not happen. After passing urine, you should feel relieved. That's a normal person. But when you have this prostate cancer, you start feeling urine, you can't empty your bladder. After passing urine, again you feel there is still urine and you go back. That's not normal. So you present with these symptoms. In the early stages, it may be like BPH. It can be the same symptoms.
Wow. So we have someone out there who we know is passing urine with blood in it, or is passing stool with blood in it. And we have someone out there who has a relative or a mother who has had breast cancer, and they are alarmed at the moment. We would like to know if there is a possibility of them getting screened. Who can get screened, when, and where can the screening be done from?
Yeah, thank you. Prostate cancer screening can be done. And this screening can be done in the Cancer Institute, Uganda Cancer Institute in Mulago, but also we can do it in urology. We can do the screening, because screening, what does it involve? One, if there is family history of prostate cancer, for example, my dad has had a prostate cancer, history of prostate cancer, which means they have to screen me. Screening, it means you go to the hospital when there are no symptoms. These are patients who have no symptoms, but you want to try and look for the disease in them. So you do some tests and you do some examination. Yeah. The first examination you do, physical examination. You do what we call a digital rectal exam. You put your finger in the rectum to feel the prostate. I think we shall need this image. It's a most important exam. When the prostate enlarges, the rectum is like, the prostate is in front of the rectum. It pushes against the rectum. Now, when you push your finger through the rectum, you're able to touch the prostate. When the prostate has cancer, it feels hard, like the forehead. When you touch it, it's hard, and it is nodular. So it feels hard, it is enlarged, it's nodular, it's tender.
Nodular is inconsistent.
Yes. It is tender, it's hard. In the BPH, when it is benign, it is firm. It's firm like the nose, when you touch the nose.
I think, for the sake of our viewers, you have left some behind with the word tender.
Tender, you feel pain. When they touch the prostate,
yes,
there is pain.
Yes, we are together. Yes.
When they touch the prostate, there is pain. And that is the most important exam, the finger examination. And of course, it brings discomfort, but you can explain to the patient that this thing, it brings discomfort, but it's bearable. So the doctor does the direct exam. The doctor will do what we call PSA. That's another chemical. When you have prostate cancer, it releases, there's a chemical, it releases in blood. So when they remove your blood, they are able to see it, that the PSA is going up or down. By the some patients may have even a normal PSA when they have prostate cancer. So that means the direct exam is very important. Then you can also do ultrasound, scan, TV. So you do 3 things: physical examination, laboratory test, and then imaging again. Ultrasound is available. It can be done in the hospital. You'll be able to see the prostate again. When you do ultrasound, either through the rectum or even through the abdomen, you'll be able to see the prostate. And this time the prostate will look irregular again. It will look irregular, and you'll have some lesions that you may be able to see. So the screening is done in men who are 45 years, that's if there is history. But if there is no family history, there is no one in the family who has had prostate cancer, you start doing it later, maybe at 50 years, because there is no one in the family who has ever suffered from prostate cancer. You do those 3 things, can be done by the urologist again. So people have to do the screening every year. At least this program needs to be included in the Ministry of Health. I think screening needs to be an official thing, that it's done. Even in men in the deep in the villages, they need to be screened for prostate cancer. Because like all other cancers, prostate cancer may be silent when it is still early, but when you have it. So that's why screening is important.
Wow, wow. We have had instances where the doctors like to use the word in our vernacular, bakujeko akanyama, to go and they get a sample from you. So I believe there are other investigations that we can do within the context of investigating these patients. Dr. Masaba, what other things do you usually do as specialists for you to zero in on a diagnosis of prostate cancer?
Yes, absolutely. So on top of this, the screening tests are those done to just identify who may be at a risk of having prostate cancer or getting prostate cancer. Now, the other tests that you're talking about are for a person who has been screened out, that this person probably has prostate cancer. Now we need to diagnose it. And that diagnosis includes taking off a small sample of tissue of the prostate, which a specialist called a pathologist looks at that tissue in a microscope and looks for cancer cells. And that is the person who diagnoses prostate cancer. When we finish diagnosing you, we then determine, is it early disease or is it late disease? Because these two modalities are managed differently. So it is important, what our viewers out there need to understand is that prostate cancer, like any other cancer, is a very silent disease. By the time it's telling you that, hey, I'm here, it's usually too late. So our viewers out there need to understand that you need to begin screening from about the age of 45 if you have a high likelihood of having it, or from the age of 50. And there are so many wellness centers out there which are screening these cancers in the community. So wherever there is a wellness clinic, please go and have just a routine checkup for screening. If that screening test shows that you may have a likelihood of getting prostate cancer, then you come to the urologist, or you can take off a tissue for diagnosis.
The message I can hear you echoing is that prevention is better than attempting to cure prostate cancer. So we should take it very seriously. Our viewers, we still welcome comments and questions, and you can send those via the number displayed on the screen. Let us have a short commercial break and we'll be right back.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
This is it, the moment we've all been waiting for. The high school crossfire grand finale is here.
They should come here and clarify. Are they going for organic or inorganic farming?
This is what we call the high school crossfire.
Appointments Committee of Parliament is greatly influenced by His Excellency.
The passion, the intensity, these students are ready to make history.
Human trafficking is a transnational crime that needs collective action.
We, the team affirmatives, brought corruption as being the result of lack of term limits.
Stop engaging in a lot of analogical discussion that then has no causal link to your case.
We all know that human trafficking is a subsystem crime.
You both put up a good fight against each other.
Every debate round has been a showcase of incredible talent, and it's now the time to see the best of the best.
This grand finale will be an unforgettable experience. We can't wait to have you there.
The best teams walk out with amazing prizes. 5 laptops, a school water tank, 65-inch smart TVs, unforgettable trips to Uganda's top tourist destinations, and an incredible opportunity to represent Uganda at the ESDC in Istanbul, Turkey. Join us at Mulago Hockey Grounds on September 30th for the High School Crossfire Grand Finale. Be part of the excitement, the passion, and the triumph. See you there. Audio Jungle.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from the commercial break. This is the DOCtalk Show, proudly sponsored by the Ministry of Health of Uganda and its partners. We have had a discussion about prostate cancer, its causes, its symptoms. We have also discussed the need for us to screen for it, especially in the context of someone who has had a relative first-degree relative having prostate cancer. If you have a mother and he has had a history of breast cancer, please go and screen. And if you are at the age of 50 and above, even when you feel all is well, please go and be screened. So life happens. Prostate cancer is a reality of our society. If I am found with prostate cancer, how would you manage me if placed within your hands, Dr. Masaba?
Well, prostate cancer, just like any other cancer, is a silent disease. And that is why screening is important. Of course, we don't want to scare the public and overwhelm them into doing overscreening. There's also something called overscreening. So what you need to be aware of is take a personal initiative into your own health. All right? Have a regular checkup so that you can pick up these things early. Prostate cancer, when caught early, is curable. All right? The problem we have, that we face at the National Referral Hospital, even at the Cancer Institute, is that many clients come late. They come when they are already having difficulties to pass urine, they're already having bone pain, they are paralyzed, they can no longer walk, and at that stage, it's not curable. So when caught early, there are modalities that we use to manage or to get rid of this cancer. And there are two modalities that we use. Number one is for me to cut it out, all the cancer, and take it out of your body. If caught early, it's curable. It is curative. 100% curative. Number two is for me to refer you to the Cancer Institute, where now you have a specialist called a radio-oncologist. This is a person who specializes in using high energy, high sources of energy. We use gamma rays to burn the entire tumor out of your body. So when caught early, prostate cancer is curable. But as I said, the majority of our patients come late when this cancer has spread beyond the prostate gland. That is beyond the confines of surgery or radiotherapy to cure. As Dr. Odongo is going to tell us how we manage those advanced cases. So when a patient comes and this tumor has spread beyond, we now resort to what we call palliation. Palliation, basically, I am not curing you, but I am giving you whatever, I'm doing whatever is possible for somebody to live a comfortable life, to live a life when they are not in pain, they are not passing urine through a tube, they are not paralyzed, they are eating well, and their nutrition is okay. So there are modalities we use to make sure that a person stays in that state.
So in palliation, you have, as well as a doctor, accepted that this person is going, but you want to help them to live their lives with dignity and with as little pain as possible.
Yes, exactly. That is the simplest way of putting it. So basically, I am not saying that this patient is going to die in 1 month or 2 months or 5 years. I don't have the capability to see what is in the future. So what we do by palliation is that we may not add years onto where you're supposed to depart this earth, but we add quality to those years. That is, you're not in pain, you're able to do your activities of daily living, you're walking around, you're pain-free, you're passing urine without having to use a tube. Yes, and we do that by manipulating a hormone, which Dr. Odongo is going to tell us.
Yeah, thank you very much. To add on, in addition, prostate cancer depends on the male hormone. You know, there are hormones in the body that makes you a man. a hormone that makes you look a man. It's called testosterone. It is produced, most of it comes from the testes. Now, prostate cancer relies on testosterone, which is the male hormone, to spread, to grow, and even it's like fuel for prostate cancer to move around. Now, without testosterone, you are going to starve it. You're going to remove away its fuel that it uses for moving around the body, because cancer moves around the body. Now we are going to remove that ability from it. And that's what you do when the cancer is advanced. When the cancer is already moving around, it has gone to the back, the patient has back pain. You know, prostate cancer likes moving to the back. It's a bone-seeking tumor. It goes to the bone, then you feel bone pain. So by removing testosterone, you are going to remove that ability of prostate cancer to keep spreading everywhere. Now, how do you remove it? You remove one by medical. You inject to the patient. There are injections you give the patient that will stop testosterone from going high, or the levels of testosterone will go down when you give this injection. It blocks it. One of it is called Zoladex. It's an injection that you give. It interferes with it's called the hypothalamus pituitary gonadal axis. Those are endocrine axis or hormonal axis in the body. So by doing that, testosterone levels will go down, and that will prevent the cancer from spreading. Now we call that castration. That is the method called medical castration.
Actually, I've been thinking, like some of our viewers out there, like you told us that testosterone is the hormone that makes men.
Yes, it makes you a man.
Now, if you block testosterone, what are you doing? Are you changing me to a woman?
No, Dr. Muyanga. Basically, by the time we reach the point of doing this, we are weighing now benefit and risk. The benefit is by manipulating this hormone, it's going to control this tumor. The risk, you manipulate this hormone. Testosterone is a hormone for sexual function, fertility, gives the men that body mass and strength. But the benefit of having it is you have all these. The risk is the disease is progressing. So we're weighing benefit and risk. If I do this intervention, is it going to be beneficial to my patient? So you end up sacrificing the pleasures of life for a better quality of life.
Yeah, so castration also, we call it androgen deprivation therapy. You are depriving the body of the androgen.
That's I think more friendly.
But
castration.
Castration is not friendly. So we call it androgen deprivation therapy. But of course, fortunately, these men can come when they are done with giving birth. Prostate cancer is so forgiving. It comes in the older age when you are done with family. You have 10 children, 20 children. The priest says, I don't 20. Yeah, so it comes when you are done with giving birth. That's the good thing with it. So even if I block testosterone, I already have my 10 children. But now what I want is to live a longer life, a better quality of life. You block testosterone, and then I live a better life. So that is one way of doing it, using injections. Then the other way of doing it is through surgery. You can remove cells that produce testosterone from within the testes. Inside the testes, there are cells that produce testosterone. So you go for those cells that produce testosterone. You don't have to remove the whole testes. You're only going for those cells. That's why we call it bilateral subcapsular urologectomy. You're preserving the testes. And when the man goes to touch the testes, they are there. Even when you palpate the scrotum, you feel your testes are there, but the contents inside have been removed. So that will lower the testosterone levels in blood, That is another way of doing it. If the medicine is not available, whether they are expensive, that Zoladex, I think, can go even up to 500,000, 1 million, depending on the formulation. And very few people can afford that. So you go surgical. You can do surgery and block testosterone. Now, there is a group of patients who, even after castration or androgen deprivation, they continue progressing. The symptoms continue worsening. Now, such patients, we call them castrate resistant. After castration, they are resistant to castration. So such patients, you send them to the Cancer Institute. They do chemotherapy. Chemotherapy is another form of treatment. It's done by the medical oncologist. Of course, treatment of cancer is always multidisciplinary. The urologist has done his part, but the medical oncologist also has to do his part. Then the radiation oncologist. So you bring everyone on board, including the palliative care team, the social workers, the spiritual people, the relatives, the social part has to be addressed. Now, this chemotherapy is done by the medical oncologist, and they are in the Cancer Institute. So these patients who are castrate resistant have to be sent to the Cancer Institute for chemotherapy. Then there are patients who have the disease spreading to the back and compressing the spinal cord. To such patients, you give them radiotherapy. You send them to the radiation oncologist. Oncologist is a doctor who has specialized in treating cancer. Now, those who treat cancer using radiation, I think people call it masanyalaze, radiation, high energy, to kill or to burn the cancer. Those ones are called radiation oncologists. Now, these ones are done for advanced disease that has gone beyond the prostate. That's what you always do for them. And you follow them up. There is that chemical I told you, PSA. You keep doing PSA to follow up. Response. Is the patient responding to treatment? Even if it is surgery, is the patient responding? Is the PSA normal? Is the PSA going up? So you keep following them up. A patient with cancer is a patient for life. So you have to follow them all the time.
Wow. That has been elaborate. I would like to thank you so much, Dr. Odongo and Dr. Masaba, for those submissions. Certainly with words like castration ringing through the course of the discussion, I am sure our viewers out there are alarmed. Thank you so much. That has been both enlightening and quite thought-provoking. We shall be back. Let us have a short commercial break. Thank you.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
This is it! The moment we've all been waiting for. The high school crossfire grand finale is here.
They should come here and clarify. Are they going for organic or inorganic farming?
This is what we call the high school crossfire.
Appointments Committee of Parliament is greatly influenced by His Excellency.
The passion, the intensity, these students are ready to make history.
Human trafficking is a transnational crime that needs collective action.
We, the team affirmatives, brought corruption as being the result of lack of term limits.
Stop engaging in a lot of analogical discussion that then has no causal link to your case.
We all know that human trafficking is a subsisting crime.
You both put up a good fight against each other.
Every debate round has been a showcase of incredible talent, and it's now the time to see the best of the best.
This grand finale will be an unforgettable experience. We can't wait to have you there.
The best teams walk out with amazing prizes. 5 laptops, a school water tank, 65-inch smart TVs, unforgettable trips to Uganda's top tourist destinations, and an incredible opportunity to represent Uganda at the ESDC in Istanbul, Turkey. Join us at Mulago Hockey Grounds on September 30th for the High School Crossfire Grand Finale. Be part of the excitement, the passion, and the triumph. See you there.
Audio Jungle.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from the commercial break of the Doc Talk Show, proudly sponsored by Ministry of Health and its partners. We were continuing the discussion about the management. So, assuming I have been in the able arms of Dr. Masaba or Dr. Odongo, and you have done what you can. Following your treatment, what next? What should I do? What kind of lifestyle should I lead? And how, anyway, assuming you have told me that, yes, you have done the surgery, I'm 100% cured, what can I do to prevent the resurgence of this cancer?
Thank you, Dr. Muyanga, for that comment. So what I would like to talk about is life after prostate cancer. Having prostate cancer does not mean it's the end of life. There is life after prostate cancer. So our viewers need to understand is that if you came to hospital early, there is a lot that can be done for you, and this disease can be cured. The majority of our patients who come to the urology unit or even to the cancer institute come with late disease. But even with late disease, we still have a lot we can offer at the urology unit and at the cancer institute for making life, living a good quality of life with the diagnosis. So the take-home message is early diagnosis is curable. Now, prostate cancer, as mentioned earlier by Dr. Odongo, affects men mostly in their 8th decade of life. The only probably positive thing I can take from it coming there is that even when it comes in the 8th decade of life, it is a slow-growing disease. So many men actually live up to their 100 years, 90, 100, and probably they may depart from other natural causes other than prostate cancer. So it's something which can be managed. Now, life after prostate cancer. The life before prostate cancer, we've already talked about it. Prevention is better than cure. Exercise regularly, eat right, yeah? Live a good, healthy lifestyle. If you are genetically predisposed, that means if you have a familial likelihood of getting prostate cancer at a certain stage in life, come to hospital early for screening. And we catch this thing before it causes problems. So when we've diagnosed with prostate cancer, even for those with early disease, we always recommend routine surveillance follow-up. Surveillance means even when I'm on treatment or if I've had my surgery, I'm okay, I'm feeling fine. Every 3 months, I have to come back and we check and see how I'm doing. When we do the treatments for cure, we do that follow-up for minimum 5 years. Beyond 5 years, that's when I can comfortably say, now I've cured you. However, even when we do these surgeries, there's a likelihood that this disease may come back. And that means the confines of surgery. If I operate and remove the entire prostate gland, you never know. There could be a
UBC, inspiring Uganda.
Hello and welcome to News Tonight. I am Rhoda Ngonzi. We will dig into it. President Yoweri Museveni has commissioned the 600 megawatt Karuma hydroelectric power plant in Chiriandongo district. The $1.7 billion facility is poised to enhance the country's energy stability and fuel economic growth. President Museveni emphasized the need for continued investment in power generation to ensure future demand does not outpace supply.
The Karuma hydroelectric power station stands as Uganda's largest power project to date, with a generation capacity of 600 megawatts. Commissioned by President Yoweri Museveni, the power plant is expected to transform the energy landscape by addressing power shortages and accelerating economic development across key sectors.